to talk to the doc. I have to hit the record button there. And it's brought to you on Tuesday mornings by Mako's Market and Pharmacy in downtown Uricksville. Come in. Check out Mako's Market and Pharmacy, and they can help you out with all of your health needs. And we have Dr. Tim McKnight in studio. First time for the new year. Good morning.
Good morning.
Welcome to 2020.
Yeah, thanks.
And we're off and running. This is also week number 1 for the next Fit for Life program. I can't believe it's the winter session starting already.
Yeah, we're real excited. We've got, I think, 52 people registered this time, and the classes are being held at the New Philadelphia Community Hospice Center.
So this is the first time in all the years that it's been away from the hospital.
No, we've done it away before. Actually,
okay.
We did it on the boulevard with the Community Hospice
I
probably
didn't
10
realize
years
that.
ago.
Okay.
Yeah, that was when we were actually, one of the grants that allowed us to go into businesses and do it with the employees where they work.
So the majority of the folks that are in this session of Fit for Life will be connected with hospice somehow?
I'm guessing about half of them.
Okay.
20, 25 probably are, but then we have other individuals outside of hospice that'll be there.
It's always a good time, and so for the next 12 weeks, correct? 12 weeks?
Yes, next 12 weeks.
It's going to be a different topic, and we'll get to that here in just a few moments. Talking about the new year and some things that you deal with, one of those is you look at different numbers throughout the year of types of death and things like that, because I know you have to sign off on certificates of death, and then those all get compiled, and that helps to determine causes of death and things like that. Not something we want to talk about, but it's interesting, I guess, as far as how to determine what types of things people are experiencing.
Yeah, and we're going to talk about that tonight in class, because we know that the leading cause of death in the United States is heart disease, and then right behind that's cancer. Mm-hmm. And then I think the third leading cause by the CDC vital statistics reports are upper respiratory infections, if I'm not mistaken.
Oh, great, as I'm fighting this thing for the past 3 weeks here.
But, it's interesting when you look at, well, how do we know that? Well, this data is generated from death certificates that physicians sign off on. And
so every county, every state does this.
And the death certificates come from the funeral homes, mm-hmm. and then the physician, they typically want these signed and back to the funeral home within about 48 hours. So we have to determine why somebody died. And you'd think, well, that would be easy. Sometimes it is easy. If we were with them or they were in the hospital, we know what happened. But many times that's not the case.
Mm-hmm.
The last death certificate I signed was for one of our nurse practitioners who are not authorized to sign these death certificates. And the patient was found, left and was with a family member, and an hour later the family member came back and they had collapsed. They were in full cardiac arrest.
Oh, wow.
And so they came to the emergency room by squad, and they were doing CPR, and the person wasn't able to be saved. So now I have to sign off on a death certificate and say why they died. Well, that's not always easy,
Right.
The heart stopped, but it doesn't mean it was a heart attack.
Mm-hmm.
Could have been an electrical conduction problem. Could have been a blood clot. Could have been a number of things that caused them to die.
So what you're saying is basically some of these numbers or some of these causes are not always the what they appear to be. Then
that's right. They could be a little bit skewed. So
yes.
I think I think we can believe that when we say heart disease is the number one killer, that's probably the case, and probably cancer is pretty accurately the second leading cause of death. But in some reports, they've estimated, and they've really looked at this closely, that medical care is the third leading cause of death. Okay?
Wow.
So we're talking about too many medications that interact, and they can cause heart rhythm disturbances.
Oh, my.
They can cause respiratory arrest, all kinds of issues. And so, but what's interesting is if I'm signing a death certificate, I'm not going to be thinking, as a physician that believes that medication is what we do with patients, that
mm-hmm.
medication caused this person to die. So that's not going to appear on most death certificates. But I can tell you, in the emergency room, many times these people come in, and I've seen this with different patients through the years. there is a strong suspicion when we look at their medication list, and we know that some of these medications in combination with others are bad for the heart. They can cause heart rhythm problems.
Right.
Maybe they did die of cardiac arrest, but not because of heart disease, because of medication. So the point is the third leading cause of death may be healthcare related, but we're not going to be able to prove that easily because the way the data is generated by the CDC.
But the other thing is you're signing off on some of these death certificates, and these are people that are not even your patients, so you're really not privy to the history and everything else. So
That's
I mean,
right.
You got to kind of wonder about
tough.
a lot. Yeah.
So I'll review their chart and I'll see, okay, they've had emphysema for a long time, and they're wearing oxygen, and then they have some heart disease, and I make my best guess, but it's not always accurate.
Right. Interesting. That's fascinating.
Yeah, it really is interesting. So,
is this something like you guys compile this throughout the year, and then you get the results at the beginning of the next year, or is it done in 12-month increments?
When I sign off on the death certificate, I send it right back to the funeral home, and I don't see any more.
Okay.
So I think they submit that probably to the health departments, or somehow it's collected by the CDC. The vital statistics report, and then we see this list of the 10 leading causes of death based on that information. The one thing that they want to know is they tell us we don't want you to tell us that somebody died of cardiac arrest. We want to know that what was the reason for their arrest. Was it coronary artery disease? Was it a heart rhythm disturbance? And then they want to know, was smoking involved? So we check off on that. Were they pregnant? Did they die of natural causes?
Right.
So there's really just a few items that they're interested in on that death certificate. Of course, that's a document that stands forever, right? If you're doing genealogy and you find this information, okay, this is what they died of. And it's kind of interesting when you go back 100 years ago to see how those were signed off on. Dysentery, diarrhea.
Right. Don't get a lot of those probably these days.
Yes. No. So, but it's just one of those dilemmas that we're caught up in as we try to take care of patients and report what's happening. So again, when you see this information, you have to stop and think, how is it generated? How accurate is it?
Wondering, too, this time of year, it's been, for us at this point, somewhat of a mild weather winter at this point. We haven't had a lot of snow, really deep plunging temperatures.
Yeah.
How's that affected the different types of viruses and ailments that are out there? Is it a pretty quiet season at this point?
I don't know if you can really attribute it to the temperature, but I'll tell you, this year, the last 6 weeks has really impressed me with the number of people with upper respiratory infections.
Right.
And it's not really the sinus, head cold kind of stuff. It's deep in the chest. Coughing and wheezing and pneumonia and bronchitis and asthma.
Right.
And I think, to me, it seems like it's got something to do with the damp air. I talked to one of our pulmonologists about this last week. I said, what is it about coughing that makes people have more issues with this at nighttime? Because that's, they're complaining, I can't sleep, I'm coughing all night.
Sure.
The cough seems to be worse in the evening. He said nobody knows. We really haven't been able to identify that. But I can tell you that based on the circadian rhythm, early in the morning your body releases cortisol. That helps you wake up and get moving. Cortisol is like prednisone. So in the morning, we usually feel pretty good. Physically, we don't hurt as bad, but the fatigue and the aching comes later in the day when the cortisol level drops off. The steroid effect drops off, and steroid has anti-inflammatory properties. So it could be in the evening as cortisol levels drop, we lose the anti-inflammatory effect.
Sure.
There's more coughing. That's just my best guess. But anyhow, it's really interesting. So upper respiratory infections are bad right now.
Flu has not been at this point.
Flu is all around us. I'm not sure we've really seen it hit real heavy in the county yet, but we're expecting to be here soon.
We're talking with Dr. Tim McKnight from Trinity Hospital, Twin City. Talk to the Doc, presented by Mako's Market and Pharmacy each and every Tuesday morning. Come in and talk to your pharmacist at Mako's. A lot of good information. They can point you in the right direction. I know you rely a lot on Mako's. Their pharmacists are pretty knowledgeable about the supplements and about the different, like you say, you got to question, am I getting a medication that's maybe going to conflict with another one?
Right.
Always ask the pharmacist.
I've said this before. Pharmacists generally are very intelligent but humble people, and I think we underestimate their value. And if you would just go in and ask them, hey, what do you recommend? I think they can really point you in the right direction.
Good advice.
Cough medicine, cold medicines. I'm actually on my way over there when I leave here to get some turmeric and something else, because I need that anti-inflammatory that supplement provides.
Right. Great supplements, and of course they are Nutriscriptive is their brand, and I know we both are very high on Nutriscriptive and good quality supplements. Some you buy in different stores, not so much.
Right.
I mean, not going to rip on anybody, but Nutriscriptive is top shelf.
Yeah, they're high quality, and they've got a good track record, and I've seen good results in myself and with patients using the Nutriscriptive line.
All right, briefly before we wrap up today, tonight, week 1, Fit for Life.
Week 1.
Where do we begin? How do we? What are we getting rolling with?
Yeah, we're talking about the wellness crisis, and we'll talk about the leading causes of death, your risk for heart disease, your risk for cancer. We'll talk about the increasing prevalence of diabetes and obesity and why that's happening. We're just setting the stage and helping people start to think, oh my gosh, I'm a victim here, and then what am I going to do to fix this?
And then we'll dive into those topics the next 11 weeks to dissect them and make you understand what's going on with your health.
And, I am so excited. There is so much good information. I'm trying to find a way to delete some of the content that I normally present and say it's in the workbook, read it, but I got to share you this information with you. I've got to talk about telomeres, and I got to talk about nitric oxide and vasodilation, all this other stuff. So I'm really excited.
Yeah, it's a good time.
I'd never want to keep anybody sitting in a chair longer than 90 minutes. So it's a challenge for me, but it's going to be fun.
It's a fast evening every week. It goes very quickly because you're covering so much important information. So, Dr. Tim McKnight, always good to catch up. We'll do it again next Tuesday.
I'll be here. Thank you.
And Talk to the Doc, of course, again, presented by Mako's Market and Pharmacy. If you have any questions, you can submit them to us here at the radio station. We'll pass them on to the doc. And we'll do it again next Tuesday morning right here on Big Hits, WBTC.